Hi, everybody. This is Amanda Martin with Athena LLC, and I'm here today with Matthew Howe, our instructor for bodywork for PTSD, from Florida, visiting Montana. And Matthew, can you tell us just a little bit about the PTSD course, the difference between 1 and 2?
Sure. The Bodywork for PTSD 1 and 2 courses are both trauma-informed, meaning that we don't need our clients to go back through the trauma in order to begin the recovery process. So in PTSD 1, we get into the basics of how to have a conversation with the nervous system and begin establishing rapport with the client, whether it's a new client or an existing client. And then in Bodywork for PTSD 2, we work in transition from going from survivor mode into thriving mode so that they can advance their recovery a little bit further and begin growing beyond needing to receive the treatment to going back to traditional massage for the benefit of just well-being.
How did you come to find a passion for this work and decide that you wanted to tell everybody about it?
Well, the sad part is that trauma finds everybody. My wife had a history of car accidents. I had been in a few car accidents myself. I lost my father at a pretty young age. I was 22 and he was 52. Shortly after that is when I got into massage school, so I started looking at the connections between the psychology of trauma and the somatic side of trauma. And early in my career, did a lot of work with chiropractors and was working with motor vehicle accidents and seeing the impact of trauma in that side. And then my years working in the spa, meeting people from all over the world with all kinds of life experiences, looking at the common bonds and seeing the grips that trauma had on people's lives, whether it was physical trauma or emotional trauma, really understanding and wanting to give people the possibility to recover so that they didn't have to live their life with one foot behind them. The trauma recovery process in our profession misses a couple of things, where we have a separation between disciplines, where we have mental health counseling and then we have massage therapy, trying to separate the mind-body connection. And I just believe that you can't separate the two. So once I started seeing the common bonds and the common threads between the different types of trauma, the different populations of trauma, I began to recognize that there needs to be an education that covers the entire spectrum of trauma and post-traumatic stress disorder, not just the veterans or abuse or the different pieces. It just needed to be, let's look at all of it so that we can help them all.
Great. How long have you been collecting your research for this course, or how long do you feel like you've really had the hands-on touch with this?
The collection of information in the development of this course started when I was in massage school, because my wife, now classmate / on the down low girlfriend then, got into a car accident on our way to massage school one day. And one of the owners of the school, she sat down with me, being able to watch her deliver this very compassionate massage session with her the same day as the car accident. And that really kind of tweaked my nugget a little bit to go, we can really have that kind of impact in real time. From there, it just kind of grew into the different types of trauma, looking at people who were in a motor vehicle accident, what happened in the accident, and kind of piecing together the physics of the trauma, and just learning from different people, different modalities, different styles, different disciplines, like what's a physical therapist's take on trauma, what's a mental health counselor, what's the difference between a psychologist and a psychiatrist, and their approach to treating people with PTSD, and looking at it and going, how do we bring all of this together? What are the common bonds? What are the seams? And being able to have a specific lens in which I look through at trauma, looking at what does the nervous system do? Because if we can't win the conversation with the nervous system, then we're just working on people. And I wanted to build a curriculum that we taught students how to work with people. A big, big difference, minor semantic shift, but it's a huge difference when it comes to the clients.
Absolutely. Tell me a little bit about the craniosacral class that you teach.
The integrative craniosacral therapy program that I teach blends a lot of the different schools of craniosacral therapy into one program. There were bits and pieces of each one that I really liked, and then there were other pieces that I just didn't find effective in my own practice. So instead of trying to reinvent the wheel, I just accumulated a bunch of the different styles and techniques and applications, and I started researching where those people learned their techniques. So I went back to Dr. Upledger, I went back to Sutherland, and I went back to A.T. Still and started looking at where did the separations happen, and looking at how can I write a curriculum that involves the integrative piece of bringing all of the schools together, but then also making sure that therapists who learn the techniques can integrate it into their practice. Craniosacral therapy tends to be this sort of standalone monolith of a modality where people only do cranial work, sometimes do massage. But I learned cranial work before I started working in a chiropractor's office, and then I took it with me through all of the years that I worked in the spas and brought it to people, to where every spa that I worked at, I brought craniosacral therapy with me and really forged the curriculum that I teach in that high volume environment of what's the real purpose of this individual technique, and can I fit it into the flow of a regular massage, so that it didn't have to be this separation of this or that. So that's where the idea behind integrative craniosacral therapy came from.
Great. Where do you see the most benefit for the clients who receive that integrative craniosacral work with massage? Do you see better activities of daily living? Do you see better gait function? All of the above? How would a massage therapist use that integrative bodywork of craniosacral therapy with their client, and what results would you expect them to find?
What I noticed in my practice was, as I integrated the craniosacral therapy techniques, it became, can we see how it affects our clients? So as opposed to saying this technique, you can expect this outcome because we're in a conversation with the nervous system and the self-correcting mechanisms in the body, it's how does the client adapt to the work that we did? So that's where follow-up, follow-through, next appointment, they come in. If somebody came in and they had whiplash, and we did our traditional neuromuscular or myofascial release for whiplash, and then we sprinkled in some craniosacral therapy, the idea would be at the end, we're smoothing out the nervous system so that the body can then integrate the work that was done through the massage and body work, so that the patient or client doesn't have that longer recovery time. So it kind of smooths the edges and allows the nervous system to recover a little bit faster. If we did the cranial work at the beginning for somebody, say somebody with post-traumatic stress disorder, we could do the cranial work at the beginning to sort of set the tone for the treatment, to put them in a place where they're a little bit more compliant in their tissue and in their responses, so that when we apply our massage techniques, they'll be a little bit more effective, and the therapist doesn't have to work as hard to get into the tissue because the client's already primed and ready.
Great. Last thing, tell me a little bit about coming to Montana and your venture kind of out west with this bodywork. What makes Montana such a special place?
Well, the fact that I'm here says something already. When I started teaching, I didn't really know where this was going to take me. I got encouraged by the massage school owner that I went to massage school at. He hired me back on as a staff instructor, and then over a couple of years of watching me teach, he's like, look, I think you need to become a CE provider. You've got a skill, you've got a talent, you've got a good delivery, you need to go do it. The way that Montana happened was just organic growth through meeting a friend at another massage school that I taught at, and just kind of having a conversation with yourself and saying, why don't we roll the dice on Montana? And for me, coming out to Montana is so different than Florida because there's snow, one. It's a lot more brown this time of year. But just the pace, the speed, the gentility of the people that I've met since I've been here has been pretty astounding. Just kind of the feel of the ecosystem of Montana, it feels different. This is definitely a place that I would like to come back to bring more classes to. The class that we're currently teaching, the students that are in this class are a pretty good caliber good questions, engaged type of student. So that's the kind of ecosystem that I enjoy teaching at. And not to mention being in a different ecosystem than what I'm traditionally used to is really enjoyable. Just kind of the vibration of Montana. I kind of get why people choose Montana. Like, I don't know what it's like in January or February or March, if I would feel the same way. Maybe with some snowshoes and some Gore-Tex, I could probably make it happen. But the draw to come to Montana is, for me, especially with the PTSD class, is trauma's everywhere. And if this is an underserved community, then I need to bring the message here. So that's why we're here, and that's why we're looking to come back.
Great. Thank you.
You're welcome.
We appreciate your time, and appreciate that you came all the way from Florida to Bozeman, even with cold weather.
My pleasure.